All right, here we go. Hello, everyone. My name is Dr. Marty Kotler. I want to thank you for attending this webinar on acupuncture and massage therapy, billing and coding. Just a quick disclaimer before we get going. The information in this program is for educational purposes, and it's not intended to be a substitute for your thorough clinical decision making. It's not intended to substitute your billing protocols. It's not intended to be legal advice. Target coding does not provide legal services. CPT is a registered trademark of the AMA, and every attempt has been made to make certain that the information in this program is 100% accurate. However, it's not guaranteed. We have a lot of people listening to this program today. Some of you are past attendees of our webinars and seminars. Some of you are members of Target Coding, and some of you are brand new to my company. So for those of you that have no idea who I am, let me tell you a little bit about myself. I am a chiropractor. I practiced for 16 years prior to starting my company, Target Coding. I am also a certified professional compliance officer and certified billing and coding specialist. My area of expertise is in coding, billing, cash practice compliance, documentation, durable medical equipment, risk management, record keeping, Medicare, and HIPAA. You know, I consider myself kind of unique. Let me tell you why. Most doctors are not certified coders. Most certified coders are not doctors. So you'll see during this webinar how I combine both specialties to help you improve productivity, maximize reimbursement, reduce administrative burden, and show you how to get paid for everything you do. You know, Target Coding has been helping thousands of doctors and their staff members for over 15 years with our exceptional products and services. A couple other housekeeping things. Target Coding members, once this webinar is completed, feel free to download your certificate of attendance. There's a screenshot on your screen of the certificate of attendance. It'll be waiting for you once you log into your account. And you know, we recommend you place your certificate of attendance in your billing and coding policy manual. Use the certificate of attendance as proof that you take billing and coding seriously and you care about preventing fraud and abuse. So put your certificate of attendance in your Target Coding billing and coding policy manual. Now, if you're not a member of Target Coding, non-members of Target Coding, if you would like a certificate of attendance, no problem, just let us know. Send an email to info@targetcoding.com and we'll email it to you. Also, Target Coding members, if you would like to get the playback recording, all the PowerPoint slides, the notes, and all the forms that I'll be showing during this webinar, just log into your account after the program is completed, and those items will be waiting for you to download. Also, just in case any of you lose track of the programs you take with us, don't worry, we keep track of all the CE, non-CE, on-demand, plus all the products and services you purchase from us. Any questions? Email info@targetcoding.com and one of our staff members will get back to you right away. Okay, let's begin. Acupuncture and massage therapy, billing and coding. Let's start with acupuncture. Brand new patient comes in for acupuncture. What do they need to do? They need to fill out forms. Certain forms need to get filled out. You should have a good quality new patient health history questionnaire. It's a good idea to have a specific health questionnaire relates to acupuncture. Make sure the patient fills out every section on every page. No blank spaces. Also, take a look, staff members, front desk receptionists, take a look at what the patient puts down on the form. For example, for a reason for the visit or chief complaint, some of you will offer a free exam, maybe through a social media promotion or you were at a spinal screening. And now the patient comes in. Here comes Mrs. Smith, and she's filling out your new patient health history form. Under chief complaint or reason for the visit, Mrs. Smith writes down free exam. That's not acceptable. Give the form back to the patient. Mrs. Smith, do you have neck pain, upper back pain, mid back pain, low back pain? Mrs. Smith says, oh, I have low back pain. Give the form back to her. Let her write in her own handwriting, lower back pain. Also, have a good quality HIPAA form. It should be posted in your waiting room. You could laminate one, put it on the coffee table in your waiting room. Some of the offices we work with have a television monitor that loops chiropractic messages. You could have your HIPAA notice on that screen. Now, you have to have a form that the patient signs that they've had the opportunity to review your HIPAA notice. By the way, you can give every patient your HIPAA notice if you'd like. You don't have to save paper, but if you want to, you could. Target Coding's HIPAA notice is a 2-page form and then a 1-page sign-off form. It's called the patient acknowledgement of HIPAA notice. It's on the screen right now. Informed consent for acupuncture, yes. You should have an informed consent specifically for acupuncture. You know what informed consents are. This is the form that talks about the possible complications to your services. Patients need to know what could happen if you do acupuncture. Can the patient get an infection, redness? You're sticking needles into the patient. So have a good quality informed consent to treat. Check with your malpractice insurance company on that. And then also the good faith estimate form as it relates to the no surprise law. You've probably heard of the no surprise law. The name says it all. You're not allowed to surprise patients with a balance. You have to let them know how much things are going to cost before you provide the services. So this is for your cash patients, uninsured patients, patients that have insurance but they don't want to use it, or they have insurance but it doesn't cover your services. In this example, acupuncture. So here's a sample good faith estimate form. You probably don't call it a good faith estimate form. I know what you call it. You call it a financial care plan. It's the same thing. By the way, your financial care plan good faith estimate form should have 3 things on it that you probably don't have on yours. I've reviewed thousands of these good faith estimate forms over the past 15 years, and 3 things are typically missing: the NPI number, the tax ID number, and the diagnosis. NPI, tax ID, diagnosis. Now, I know some of you are saying, Dr. Kotler, I don't understand that. Our financial care plan form doesn't have those 3 things. I don't understand. Why do we need that? You know what my response is? I don't understand it either. But I don't make the rules, I just explain them. I read a lot of laws, rules, guidelines, statutes, and sometimes I shake my head and go, come on, this is a real statute? This is a law? This pertains to a chiropractor? I don't get it. And then, I shake my head again and go, I don't understand some of these rules. I just explain them. So here's a sample good faith. As target coding members, you're going to receive this sample acupuncture financial care plan form. Now, patient comes in, it's going to get acupuncture. The acupuncturist should be putting together a treatment plan. A treatment plan should consist of the history, exam, the diagnosis, the goals, and the acupuncture services you're going to be rendering. And if you've been to my seminars and webinars in the past, you know how I always make a big deal about putting together a good quality treatment plan. Look at that house in the bottom right corner. It doesn't have a good treatment plan. The treatment plan is like the foundation of a house. That house is crumbling. You want to have a good foundation. So a history, basic history, chief complaint, HPI, to include how did it start, when did it start, pain scales, what has the patient done in the past for the condition, what does the condition prevent the patient from doing, review of systems, and then the PFSH. That's all part of the history of consultation. The next part of the treatment plan is the exam, and acupuncturists typically look at things that maybe a typical chiropractor would not. For example, many acupuncturists will look at the tongue, look in the ears, check the pulse, look at the skin. So do a good acupuncture exam. By the way, the documentation requirements for E&M codes 99202, you should see them on your screen, your new patient codes 99202 through 205. And then your re-exam codes 99212 through 215, the documentation requirements had a major makeover a few years ago. So the documentation requirements for your exams and re-exams are now based on 2 key factors. Those of you that attended my seminars and webinars prior to these guidelines, remember we had to go over the history. We had to have all these bullet points for the exam. We had to have 12 exam findings. Those days are over. So make sure you're aware of the E&M guidelines. Again, it's based on two key factors, time or decision making. And this all started with a patient initiative that the federal government put out a few years ago. Here's what this document looks like. When I saw this a few years ago, it got my attention. Patients over paperwork, what's this all about? It's about two things: helping doctors and staff members reduce administrative burden. Yay, that's a good thing. And allow doctors to get paid for every minute they're with a patient. Yay, that's another good thing. So this caused the AMA to rewrite their documentation guidelines for exams and re-exams. There's the cover page of this document. This is free. You can go Google it. You could download it. It's about 25 pages, and it takes you through the documentation requirements for your exams and re-exams. I'm going to share a little bit with you right now. The time factor, there it is. There's the time components. 99203, 30 minutes, 99213, 20 minutes. I have those highlighted in blue. Those are the two most common new patient and re-exam codes done by chiropractors. Now, the time component includes things that were never included in the past with the old guidelines, like reviewing MRIs, reviewing x-rays, reviewing lab work, reviewing records and tests that the patient brings in. Also communicating with other healthcare providers, documenting the encounter. Yes, the time it takes to document the encounter is included with the time component. So make sure your acupuncturist is aware of that. And the other key factor is decision making, medical decision making. So the decision making is composed of three elements: the amount of problems, number one; number two, the data to review; and number three, the risk level. The risk level includes morbidity and mortality. So make sure acupuncturists are aware of these guidelines. Now, a full acupuncture treatment plan, which consists of those things I mentioned, is available if you purchase our customizable forms, logs, letters, and templates. We have a whole section on acupuncture. We have sample acupuncture treatment plans, SOAP notes, re-exams, acupuncture financial disclosure forms. They're all in our package of customizable forms, logs, fight back letters, and templates. Now, here are the acupuncture CPT codes. There are 4 of them. The first one is 97810. This is acupuncture, 1 or more needles, without electrical stim, initial 15 minutes. One-on-one contact with the patient. Next, 97811, acupuncture, 1 or more needles, without electrical stim, an additional 15 minutes of one-on-one with the patient with reinsertion of new needles. 97813, acupuncture, 1 or more needles with electrical stim, initial 15 minutes, one-on-one with patient. 97814, acupuncture with electrical stim, each additional 15 minutes, one-on-one with the patient with insertion of new needles. Now, some of the acupuncturists we work with do auricular acupuncture. There is a code for auricular acupuncture. Before we get to that, you may be able to charge your Medicare Part B and Medicare Advantage Plan patients for acupuncture, verify coverage prior to billing, obtain proper and signed patient paperwork, make sure you get the patient to understand your financial policies. That's also part of our customizable forms, logs, letters, and templates. S8930, that's a HCPCS code for electrical stimulation in the ear. Electrical stimulation, auricular acupuncture points, each 15 minutes, one-on-one. That's S8930. Some of the acupuncturists we work with, they want to charge the patient or the insurance company for the actual needles. So here are the codes. A4212, that's use of non-coring needles. A4215, use of sterile needles. Now, when your acupuncturist walks into the room to see the patient, there's 3 services: pre-service, intra-service, post-service. Pre-service, greeting the patient, doing a brief history. Intra-service is actually doing the procedure, positioning the patient, locating the points, checking on the patient, removing the needles, and then the post-service is documenting the encounter, giving the patient some home care instructions. The acupuncture time increments one-on-one with the patient could include the following: reviewing the chart, discussion with the patient, reviewing the last treatment, examination of the pulse, the tongue, skin, ears, washing hands, palpating the acupuncture points, inserting the needles, manipulating the needles, removing the needles, reinserting the needles, disposing of needles, and counseling and coordinating care with the patient. That's a typical encounter with an acupuncture patient. So the sample notes for acupuncture are also part of our customizable forms, logs, and templates. Let's say you are going to be treating a patient that has Etna with acupuncture. Get your hands on the acupuncture policy. Every insurance company has an acupuncture billing, coding, and documentation policy. So showing you the one from Aetna has a lot of good information. So the treatment plan, sample soap notes, re-exams could be purchased from us through our forms, logs, letters, and templates package. By the way, you may be wondering, where do I learn all this information? Where do I get my information? Usually during my live seminars on the breaks, a lot of chiropractic assistants will come up to me and ask me, how do you learn all this stuff? Well, to begin with, I read a lot of books. I'm a sponge for learning. I'm always referring to guidelines on CPT, diagnosis codes, HCPCS codes, HIPAA, always referring to the Medicare Claims Processing Manual. Just right before this webinar, I was on the Medicare Claims Processing looking at how to bill and code for Medicare Advantage plans. So I'm reviewing these updates, reviewing these guidelines from Aetna, Cigna, United Healthcare. I spend probably about a third of my work week reading guidelines from all the insurance companies, and I enjoy reading these guidelines. I know it might sound unusual. We all have strengths and weaknesses. I like reading updates. I like reading guidelines, statutes, rules. I want to keep the entire chiropractic profession up to date on the latest. I also get information from all the individual chiropractic state boards, from the National Board of Chiropractic Examiners, the Federation of Chiropractic Licensing Boards. I'm always staying up to date on the latest from the malpractice insurance carriers. They put out newsletters and they give sample vignettes. Besides billing and coding seminars, I teach risk management, malpractice prevention, medical error seminars. So I like to stay up to date on all this stuff. All right, let's move on to the next topic, which is massage therapy, billing and coding. Let's begin with a massage therapy patient initial visit. Again, forms need to be reviewed. HIPAA notice, financial care plans. Is this something you're going to be charging patients cash? Make sure you have a massage therapy. I would recommend a massage therapy health history questionnaire, massage therapy financial care plan form, letting the patient know the difference between medical massage, which is covered by insurance, and spa type massage, which is not covered by insurance. Here again, all of our financial massage forms, sample treatment plans, sample soap notes are in our package of chiropractic forms, fight back letters, logs, and templates. Okay, so we have a massage patient, history, basic, chief complaint. Where does it hurt? Why does it hurt? What have you done for it? Have you been to other massage therapists? Typical examination, quick exam by the massage therapist looking for muscle tightness, spasm, muscle ropiness, joint laxity, trigger points. Some other key points regarding massage. Make sure your massage therapist has been trained in the services that you want her or him to do. Some massage therapists, it's within their scope to do electrical stim, ultrasound, set the patient up on traction, and in some other states, they're only allowed to do massage. So check with your state licensing board. You should be getting malpractice insurance for your massage therapist. If you're billing insurance, call to verify coverage prior to billing. Some carriers don't pay for massage. Some carriers will only pay for massage if the chiropractor does it. Yes, I know that sounds unusual. There are some states, insurance plans, Blue Cross Blue Shield specifically in a few states say they cover massage, but only if the chiropractor does it. And you should understand, and I'm going to go over this right now when I go over the codes. Medical massage versus wellness massage. Medical massage is covered if you can prove that it's medically necessary. Wellness massage is typically not covered by insurance. So here is the first code I want to share with you, 97124. That's massage therapy, to include effleurage, petrissage, depotement, stroking, compression, percussion. Some of you use percussors, handheld instruments like the arthrostim, percussor. Those services, if you're going to bill for it, use 97124. 97124 says each 15 minutes. Well, the good news is it doesn't have to be 15 minutes. It could be as little as 8. I'm going to go over unit billing in a few minutes. It could be as little as 8 to bill 1 unit. The clinical rationale. Now, if you've been to my seminars and webinars in the past, you know how I talk about for every CPT code and diagnosis code, have the reason why you're doing it, have the clinical rationale. So for massage, it's used as a preparatory procedure. It's used to restore muscle function, reduce edema, reduce spasm. Now you'll see at the bottom of this slide, CCI edit. You should be familiar with that. I always talk about that when we go over billing and coding. 97124, if your billing insurance cannot be done in the same anatomic site as your spinal manipulation. That's what the CCI edit is. Here's the next code associated with massage therapy. It's 97140, manual therapy techniques. Now that includes one or more of the following: soft tissue mobilization, manipulation, manual lymphatic drainage, manual traction, myofascial release. What's the clinical rationale for this? Facilitate fluid exchange, restore movement in acutely edematous muscles, stretch short and connective tissue. This code also has a CCI edit, meaning it cannot be done in the same region as the spinal manipulation. Now, massage and manual therapy, I classify as a passive therapy. The patient is just relaxing. You see on the screen, picture's worth 1,000 words. Patient is just relaxing. Versus active procedures like therapeutic exercises and neuromuscular reeducation, the patient's doing the work. I mentioned for acupuncture, every insurance company has a policy on billing and coding and documentation. For acupuncture, they also have it for massage. Here's Cigna's policy, and Cigna works with a lot of their plans with ASH, American Specialty Health, so they have a policy on massage. There it is, massage. Now, I mentioned each 15 minutes. Good news, it doesn't have to be 15 minutes to bill 1 unit. It could be as little as 8. 8 all the way up to 22 minutes is 1 unit. Now, what you need to be aware of is you need to use total time if you're going to be billing for more than 1 unit. If you're going to be billing 2 or more units, you have to use total time. Example, 8 minutes of massage. Can you bill if you stop at that point? You see in the top left corner, 97124, 8 minutes on Mr. Taylor. If you stop at that point, can you bill 1 unit? Yes, but you don't stop. You continue to do manual therapy. Even if it's in a separate anatomic site, separate diagnosis for another 8 minutes. Logically, you would think, oh, I could bill another unit because I got to 8 minutes. You cannot. What's the total amount of time for those two 8 minute sessions? 16? Well, 16 minutes falls in the 1 unit range. You'd only be able to bill one of those codes. Now, in the top right corner, 97124 for 8 minutes, followed by 15 minutes of manual therapy. Let's total that up. That totals 23 minutes. Great. Then you could bill one of each. Any questions on this? Email info@targetcoding.com. Same logic applies here for 4 units. 23 minutes of massage. If you stop, can you bill 2 units? Yes. You don't stop. You do another 23 minutes of manual therapy, thinking, I should be able to bill another 2 units. No, that totals 46 minutes. That's only 3 units. 30 minutes of massage plus 23 minutes of manual therapy. What is that total? 53 minutes? Okay, then you can bill 4 units, 2 of each. Now, some patients come in, they'll get their massage. They don't have insurance, but they want a walkout receipt. So here's a sample statement for massage and manual therapy. Very simple, patient's name, date of birth, diagnosis, CPT codes. Give it to the patient, let them submit it on their own. And we have samples of this in our package of forms. I mentioned verifying coverage for acupuncture and massage. This is Target Coding's insurance verification form for massage therapy specifically. It asks really good questions. This is a sample massage therapy soap note. Again, it's in our customizable forms, logs, letters, and templates. Okay, we're rounding third. We're heading home. We're just about done. Just a few closing comments. Just want to let you know we have options to fit every practice. Insurance in network, insurance out of network, Medicare, cash, PI. We offer many different products and services. Besides these wonderful webinars, we offer 14 products and services. You should see my menu on the screen. So yes, of course, we do many webinars. Most of them are approved for CEUs. We do them on chiropractic soap notes, modifiers, neuropathy, decompression, shockwave, laser, cash practice, HIPAA, the most current chiropractic diagnosis codes, how to scrub EOBs and appeal denial. So check out our webinars. I wrote a book on the best codes to improve reimbursement. It has 3 chapters. Chapter 1 shows you the codes that pay for the most visits. For example, sciatica should be able to get paid for 18 to 24 visits. Short-term treatment like muscle spasms, 6 to 12 visits. So I list these in a specific hierarchy. You get cheat sheets emailed to you, so you could see which codes pay for the most visits. In section 2 of the book, I show you how to pair your codes, just like pairing food and wine, pairing peanut butter and chocolate. You should pair your CPT codes to your diagnosis codes. Why am I saying that? Your CPT codes are what you're doing. Your diagnosis codes are why you're doing what you're doing. So an example would be traction pairs with low back pain perfectly and radiculopathy. Myofascial release, 97140, pairs beautifully with myofascial pain syndrome, M7912. And in section 3, I give you 25 of the most common chiropractic diagnosis codes and the ortho neuro chiro test to support the codes you're billing. Plus, you get my FAQs that I've been gathering for the past 10 years, the most commonly asked questions at our help desk. Oh, you also get this cheat sheet emailed to you. It helps prevent denials due to diagnosis code bundling. For example, I don't recommend you bill herniated disc and lumbar radiculopathy. That's M5116 and M5416 on the same claim. The entire claim can get denied. I don't recommend you report low back pain and strained low back muscles on the same claim. I don't recommend you bill M62 codes and M79 codes on the same claim. Why am I saying that? It's based on the diagnosis code guidelines. So this book will help you get paid better, faster. It will reduce administrative burden. Many of the doctors that purchase this book, they'll take a page out of the book and they use it as the topic of the day when they're training their billing and coding staff members. Has the best PI cheat sheets in the industry. It'll help you avoid post-payment audits. Okay, other things that we do at Target Coding, we write billing and coding policy and procedure manuals specific to your practice. They get customized. It doesn't take that long for us to do this for you. It doesn't cost that much. It takes 3 trainings typically, and we send you your custom policy manual. You also get it emailed to you in a digital version. This book will give you the policies on training, discounts, documentation, deductibles, background checks. You should have a policy on documentation. Now, if you ever get asked for your notes by an insurance company, you're probably going to need to send them in. And what you don't want is to get a letter back like this. This doctor sent in his notes. Cigna didn't like them. They want money back. This is called a post-payment audit. Cigna wants $250,000 back. Ouch, that's a lot. Here's a doctor that we helped get out of a bad situation. This doctor was asked for notes. He sent in his notes. The insurance company said, good news and bad news. Good news is we're not going to ask you for any money back. The bad news is we're putting you on a prepayment audit, which causes chaos and issues. I'll tell you what you would like. You would like to get back good news. We worked with a doctor, very busy practice. She sees about 80 patients a day. She was requested to send in her notes. We worked with her. She sent in her notes and she gets this letter back, which is really good news. It says, dear doctor, based on the documentation you sent in, we found that all services were reasonable and necessary. We applaud you on your billing accuracy. That's rare. That's great. We applaud you on your billing accuracy. Great news. I love this letter. If any of you have a letter like this from an insurance company, please send it to me. I'd love to see it. We also offer our CA training series. We call it our CATS program, our boot camp. These are 6 one-hour classes for CAs, whether they're brand new or seasoned. These will be helpful. In class number 1, we go over spinal anatomy, terminology, new patient onboarding. In class number 2, we show your CAs how to fill out the 1500 form. The 1500 form has 33 boxes. We go through every one. And we also show you how to analyze EOBs in class 3. I'm sorry, in class 2. In class 3, we go over Medicare and show CAs how to fill out pre-authorization forms. In class number 4, we show how to document properly. We show CAs how to do the SOAP notes and help the doctor out in the back office. In class number 5, we go over diagnosis codes, modifiers, HCPCS codes, all the CPT codes and unit reporting for time-based codes. And in class number 6, we go over HIPAA and the 7 elements of an effective billing and coding compliance plan. We offer memberships. Level 1 is $99 a month, and that includes all of our webinars, and we do 4 to 6 webinars a month. So even if you attend only 1 webinar a month, it makes financial sense to become a level 1 member. We write HIPAA manuals. We've done over 200 of these nationwide. We do chart reviews. Our chart review program will help you SWAN. That's one of my favorite acronyms, SWAN. It means sleep well at night. What else do? We do credentialing. We'll help you get in network if you would like with Aetna, Cigna, ASH, Optum, United Healthcare. We can help you get a Medicare Provider Transaction Access Number, help you get enrolled with Medicare Part B and Part C. Let us know if you're interested. I've mentioned our fight back letters, forms, logs, letters, fight back letters, appeals, sample SOAP notes, financial policies, hardship forms, consent to treat minor. We email, as soon as you purchase these, you get them emailed to you in Microsoft Word instantly, and you just copy and paste them into your software program. We have tons of testimonials across the country. We do a few seminars. We don't do as many as we used to because of COVID, but we do seminars in hotels and also on cruise ships. Yes, we're kind of unique. We have our third annual CE seminar at sea. It's been approved for 6 CEUs in over 35 states. Royal Caribbean Symphony of the Seas later this year. I get a conference room on a cruise ship. Yes, a conference room on a cruise ship. We're done by 11. After that, go have fun, do whatever you want. Go snorkeling, scuba diving, or you could sit by the pool and drink margaritas all day. We have a lot of fun. Try and join us. Oh, I like to recommend this back support from backsmax.com. It's an excellent back brace. It has a HCPCS code. It's not expensive, very simple. Even if the patient pays cash, it's about $75 cash. However, there is a HCPCS code for it. If you're interested, contact Dave at backsmax.com. You get a really nice display to put in your waiting room. Dave at backsmaxsupport.com. Email him, speak to him about this back brace. We also have a program on how to become a concierge chiropractor. You've probably heard of medical doctors becoming concierge doctors. Well, why not chiropractors? If interested to learn about this, email info@targetcoding.com. Please check with all the carriers you bill prior to submitting claims to ensure it's compliant. We can't guarantee this information will guarantee payment from any insurance company or patient. We're not responsible for any laws or rules that may change following this webinar. And you know they change all the time. So it's important to do your best to stay on top of these changes by attending seminars and webinars and join your national and state professional associations. Stay in touch with us with the latest on billing and coding. Follow us on Instagram, Facebook, YouTube. I have over 100 free videos on YouTube. Here's my contact information. Email info@targetcoding.com. Website targetcoding.com. Telephone number 1-800-270-7044. Yes, we still have doctors that have fax machines and want to fax us information. So we have a HIPAA secure fax number, 1-844-831-2347. If any of you would like to talk to me about the topic of today, which was acupuncture and massage therapy, billing and coding, feel free to set up a free consultation with me. You could do that by scanning the QR code in the bottom right corner of the slide. Now, you could set up a consultation with me. It doesn't have to be related to today's topic. Anything to do with chiropractic billing, coding, documentation, Medicare, HIPAA, set up a free consultation. So you could scan that QR code, or you can give us a call, or send us an email to set it up. I'll be happy to speak with you. So again, I want to thank everyone for attending. I hope you learned a lot. Take care, everyone. Bye-bye.